lift today from Dr. Jennifer Levine, and she's going to explain right now exactly what she's going to do today.
Hi, I'm Dr. Jennifer Levine. I'm a board-certified facial plastic surgeon, and today we're going to be helping Corey look her best, and I'm going to kind of go over my approach here at Truth and Beauty of how we like to think of a person's face and some of the changes that occur with aging. So the first thing that I'm going to do is I'm going to take some, you can hold this mirror, Corey, and I am going to take off some of this napkin. And the first thing that I'm going to do is I want you to see what Corey did, because Corey does what we all do, is we look in the mirror, and you make that little face at yourself. And unfortunately, this is not how people see us, because we usually fix our hair a little bit, we make that little pouty face, and that's not how people are looking at us. People are usually looking at us from a three-quarter view or from other angles, and it's important for people, or for all of us, to look at our face differently. So I'm going to clean off Corey's face. And the first thing that I'm going to do is I am going to have Corey look down at her face in the mirror. I'm going to clean it off more in a second. So, hold the mirror down and look at your face down. So, when we look at our face from this angle, we're able to see some of the other volume changes that were just not visible on the front view. From the front view, her face looks perfect. You're like, oh, why is she even getting a liquid lift? But we notice that there are all of these lines and wrinkles here. Now, the important other thing to realize is that the correction of this problem is by doing this, by lifting the face from the side, okay? When I lifted her face from the side, that corrects a lot of the laxity that we see, okay? Okay, Corey, you can come back up. So for a long time, people were going to the doctor and they said, or they would say to me, I see these lines here and here, fill them. But that's not really the answer, because all of these lines and these lines actually are occurring because of what's happening in the lateral or the side part of the face. So filling the face first in the center is just not the right thing to do, and that's why you see a lot of these people who get filled and they look weird. You're like, huh, it's them, but something's different and something is wrong, because now we have a face that's volumized in the center and the lateral part of the face has been ignored. So when someone comes to me and they say to me, I want to fill this part of their face, I say, no, thank you. Okay? Or I don't say no thank you. I say, well, we're going to first start in the side part of your face, and then we're going to go to those other areas afterwards. And in this way, we're going to restore a natural contour to the face. So the contour of the face is very important to me. I personally like a lot of Disney movies, and all the Disney princesses are heart-shaped. Okay, that's the way it is. So we want to either be, if not heart-shaped, then we want to be oval. We certainly don't want to be rectangular. And that's how people are able to tell how old they are, by even 10 feet away. They're not seeing the little lines around your mouth or that you have little bags under your eyes. They can't see any of that. They're deciding how old you are based on the shape of your face. So the first thing that we want to do is we want to create this natural contour to the face and restore a youthful shape, because that's what's going to make all of us look better. Okay, so I guess I must have taken like one too many art classes, but I have to always mark everything out. So I'm going to just clean Corey's face again, because we always want it to be as clean as possible if we're going to be putting in any injectables. So I'm just going to take some alcohol. So the first thing that I'm going to do is I'm going to mark out a line between her lateral canthus and her oral contour. And then I'm going to mark out a line from her ala to the top of her trachea. Okay, and this is how I'm going to decide where my first point of the injection is going to have to be. So we like to take a very anatomic approach. So I can see that by applying some of the product right here, it's going to give me a little bit of a lift to her face. Okay, so nice. Take this mirror away from you. Excuse me. Pencil. So now I'm just going to kind of take a look at her again, and I'm going to try to see where I think the points of maximal lift are going to be. So I'm just going to move this out again. So in these lines that I've drawn, we always want to start in the upper outer quadrant of this projection. So for it, everything is going to be a little pinch.
Fabulous.
So even by doing those two little injections, you can see how this side of her face is more lifted than the other side of her face. I don't know if you guys can see that from where you are. Can you see? Can you see that she has like, I don't know if you can see from this projection, but she has like a smoother contour to her cheek. And that's with very little injection, but that's why we're starting with these lateral injection points. And then if you even look at this crease here in comparison to this side, you can see how much less visible it is on this side than it is on the other side. What?
What is the actual?
What I'm injecting? Oh, this is Voluma. This is the newest creation. But you can see that even with not a lot of product, it makes a very big difference in the contour of her face and how it's improved the lower part of her face by I haven't made any injections there. Yes? So now, I'm going to also add a few more injections to the lateral part of her face because I'm trying to pull this area up a little bit. I'm not really into heavily volumizing these people's faces, even though this is considered a filler. The idea is more of a sculpture rather than filling the face and making it look full. These lateral injections give the face a little bit more support and really help lift. How are you doing there, Corey? Of course, when you have such a good patient, it makes it much better. Okay,
Fabulous.
so again, I'm kind of using some of these more side injections, kind of like I would like if I were suturing in the operating room, kind of in the direction like I would give somebody a facelift, so that we're really getting a liquid facelift. So So you can really see how these side injections have helped pick up her fold and her crease here. Put your face down again. So now if we look at the laxity, you can see that there is more laxity on this side than on this side, even though we haven't injected into these areas directly. We'll get there in just a minute. Okay, so now just for sake of symmetry, I'm going to just inject the other side. Put a little piece on this side while I'm just working her. I'm going to do the same thing I did on the other. Now I'm just going to switch sides for this side, sorry. And just hold some ice on the other side in the meantime. So all of these products have some numbing stuff in them. So really once you start the injection, it's much more comfortable. How are you doing there, Corey? It's coming out right. Oh, yes. Well, which Disney princess do you want?
Trying to think.
Sleeping Beauty. Sleeping Beauty. I personally always like Cinderella.
Yeah,
Right? It's like I didn't like Cinderella. I don't know. I had that problem though. I always kind of was more like had to be Snow White because she had dark hair, but I thought it was really her hair. And again, I'm adding some of these injections laterally so that we give a little support to the face. Okay. So now that I've added some support to the lateral part of her face, I am not going to ignore the central part of her face because everybody still is bothered by these nasolabial folds here and a little bit by the oral commissure, but I have a lot less that I have to do because for the most part, so now when I look at her face, I don't really even see that much of a crease here, except when she smiles. So when she smiles, I still see there is a little bit of a crease, and she has some of these lines that are a little bit more on the side of her face. Yes, not to be critical. Okay, so But we're going for, we're gilding the lily, but we're going for beautiful. We don't kind of go for mediocre here. So now I'm going to move to some Restylane. Okay, so I've used some Voluma at the lateral part of her face, and that's going to be what gives me a little bit more of a lifting action. And now I'm going to use a filler that I can use a little more superficially for some of these other lines and wrinkles. So, that's right there. So smile for me. Relax. Smile. Okay, relax. Okay. So now I'm going to just add a little bit of filler in here by the maxilla. And the reason why I start here is that we need a little bit of volume in this area because everybody has some bony loss that occurs in this area, and we want to compensate for it. And it also minimizes how much filler I'm going to have to use in the lower part of the face.
It's cool to see.
So now I'm just going over some of these more superficial lines and wrinkles. Smile. Relax. Smile. Relax. Smile. Relax. So, as I said, so I'm kind of working from the side back centrally. And you can see that she's, fairly comfortable and she's not too red or anything.
No, the numbing cream is amazing.
But the product also has the numbing stuff in it. So it does, once you start injecting, it tends to get a little better. So now I'm going to use the most superficial filler for kind of around her mouth. Okay?
How long do the fillers last? Do they all have different times that they get?
They kind of all last, the Voluma is supposed to last for about 2 years. The other fillers last for about 6 to 9 months. The thing that really determines the way that you get the longest longevity to the filler really has to do with how well you were fully corrected. So when they do the studies, these people are fully corrected. That means they've had 4 or 5 syringes of filler. So if you have the right amount of filler, it's going to appear to last longer. If you're undercorrected, it's going to appear to last less time. So it really depends on how fully you're corrected. If you're fully corrected, then maybe at 6 months, maybe you'll need 1 syringe, but you're not going to need the same amount that you needed initially. But if you were not fully corrected initially, there'll be some effect with some swelling or whatever, and then you'll say, I don't know, it didn't appear to last that long, but it has not so much to do with the filler as much as were you really corrected. So The other thing that determines the length of time that the filler lasts has to do with where it was placed also. So a lot of it doesn't depend on the filler itself, it depends on the filler, the person doing the filling. And the other reason why I keep switching everything is that you want to always do the injections with a needle that is pretty sharp, because sharp needles don't hurt and dull needles hurt. So I use a lot of different syringes and I keep switching it because that helps me limit the amount of bruising that I get and also how much pain. So here at Truth and Beauty, we try very hard to make the experience very pain-free, and that, you know, we want people to be able to return to function, and they just can't do that if they're very bruised or swollen or they feel like they've been, you know, beaten up. So now I'm going to just use this as my little like airbrusher.
Is this still Restylane, or is this?
No, now we've moved on to Bellatero.
Bellatero, okay.
Yes. Yes. So we did some Voluma, we did some Restylane, and now we're doing some Bellatero. So we really like to use, and there's more fillers out there. This is the particular combination that I felt was best for Corey, but for other people, I might choose a totally different combination. And a lot of it has to do with where I see the volume loss, how much I think they need to be corrected, and where they need to be corrected. So I really kind of vary it. But yeah, there are some differences. So make a little kissy face for me. Relax. Smile. So the important thing to realize with injecting this area right here is that this area right here is something called the perioral complex. So it consists of the area of the lips, the red lips. The red lips actually have an area around them of definition that's called the white roll. And then we have the white lip. So as we get older, our top lip decreases in size, the white roll diminishes, okay, and the white lip tends to increase. But the most important thing to realize is that because this is a whole area, if you volumize one part, you need to volumize all of the parts in order for it to look normal. That's why there are those people who look like little ducks walking around, is because someone has just filled either their red lip or their white roll, and they have ignored the rest of the area. The other thing that's important to realize is that the relationship of the top lip to the bottom lip should be about 2 to 3. So the upper lip should be slightly smaller than the bottom lip. So all these people who are walking around because they've noticed that their top lip has decreased in size, and they are right. But you still have to keep the proper proportion of the lips. You can't just say, I know your top lip is smaller, but we do need to add some volume to the bottom lip so that they're in proportion, so you don't look like I've had my lips injected. That's just not pretty. Okay. Well, we're not filling your lips today, because that would just be too much. But so I'm going to go in here, and I'm going to just add a little bit of filler here. How are you doing?
Fabulous.
Fabulous. Does anybody have any specific questions? No? So even though we're saying that these procedures don't have any downtime because these products are in a family called hyaluronic acid, they are hydrophilic, which means they bring water to the area, and there is some swelling that will occur, especially over the first 48 hours. Also, this product is going to be integrated into the body, so probably at 2 weeks it will look even better than it does right now. It's not that there isn't an instant result, but you tend to look better especially when the other products start working. So what I'm doing is, I don't know if you can see it because I haven't injected this part yet, but I want the lips to be in a neutral position. I don't want there to be a downturn to the mouth, so I'm just supporting the corners of her lower lip. So her lips are in that like Mona Lisa smile, right? Not that the Mona Lisa is particularly pretty, but everyone seems to like her. Or you're much prettier than the Mona Lisa. Okay. But you can see that her mouth is now in repose in a nice neutral position. It's not going down. So what I'm doing now, just a little bit right here, just on her side, is she has a very, very faint pre-jowl sulcus. There's a little depression here, and I want the jawline to be smooth, so you have to get rid of that.
Oh, no, no, no. Right.
And because of these products have like a little bit of moldability, you can kind of inject them and then you can manipulate them a little bit into position. So, put your chin down a little bit. So I have her move her head in different directions because, as I said, I can see some of the areas of volume loss, not when she's holding her head straight. We have finished the volumizing portion of this. So the next thing that we're going to be doing is injecting the neurotoxins, but the effect of it is not going to be immediate. So she's going to notice the result in a few days, but it also can take up to 2 weeks for it to take its full effect. So you just take a little alcohol. And you just get like a little cream, like just like a little moisturizer. So I just want to.
Is there much more? Because I think we might actually have to leave. That's okay?
Well, the other part is just doesn't show right away.
Okay, so we got the most important part, right?
Yeah, so you could say what you're doing next and then like.
Yeah, so what I'm doing next, if I could just.
Yeah.
Yeah, sure. If you crease for me, is we want to use the neurotoxins in, we're not here to erase lines and wrinkles. We're also using it sculpturally to reposition the brow. So I want to create a little bit of width in the middle part of her forehead and a little bit of a lift in this lateral or the side part of her eye, so it kind of opens up her eye. so it's not so much about the lines and wrinkles that we see. Then we're going to put a little bit into her upper lip. Make that little kissy face again, to try to minimize some of these lines without making her look too puffy. And then make an angry face, grimace, is that we're going to use some of the neurotoxin into her neck to give it a little bit of a lift, to recontour the skin of her neck and help with the platysmal banding.
Very cool.
And then that will be the true liquid lift,
Yes.
which you could literally get on your lunch hour.
Thank you so much for having us.
Thank you so
said you're not
much.
supposed to, but you don't have to grab that mic.
So it should be just
Yes.
some ice.
What is that here?
Neurotoxins you mentioned.
So neurotoxins, I'm just like kind of using it because, so Botox, Dysport, Xenon,
Oh,
right
yeah.
now, there are other
Okay,
products on
yes.
the market
It's on auto.
besides
Oh, it's on
Botox.
yeah.
I can't kind of use the word Botox. These are not random injections.
No, but is that painful over there? Is that
No.
kind of gone?
She numbed her. She could cream.
No, it's just, it's a very tiny needle and it's not a lot of,
So not painful.
it's not painful. You know, it's a lot of injections, so after a while, even though she's like very good, she wants me to stop. Like, well, I'm almost stop.
No, I don't.
Okay.
It's amazing.
Now we have to just do your neck.
So tell them what you did there.
Okay. So what I just did was, there she has some vertical lip lines in her upper lip. Most people want to fill those. I don't like to necessarily fill them because that makes you look like that platypus. So those lines are caused by muscle action. So if you put a tiny amount of Dysport there, not only does it smooth it out, but it gives a very natural plumpness to the upper lip without it looking injected. So it's a very good thing to do without making you look really, really strange. Okay. And the last thing that we're going to do is I'm going to give her some Dysport in her neck. And with the Dysport, we can usually sculpt the neck and make it look smoother. We're going to help with some of these necklace lines. So it's going to also create a little bit of a chemical smoothness to her neck. Make that grimace again. Relax.
I have to say this was a very enjoyable experience.
Really?
Where is it? She's a very good patient.
Oh, it's your technique.
All right. We're all done.
Yeah.
Yes. So now I just want a little bit of cream. Just to
What is that?
Okay.
The cream?
Oh, this is,
Is it empty?
Post-procedure cream.
Oh, okay. Right, that's right. That's right. And then they put something on it that they.
so what I'm doing is I'm just feeling the areas that I've injected.
This feels good.
Just making sure that they're smooth. Okay. Not that she doesn't look fabulous now, but in 2 weeks she'll look.
Now just go to the Truth and Beauty makeup bar and
Yes.
I can return back to work.
Yes,
Lunchtime, true liquid lift.
Question, yeah.
yes.
How does this work with, like, the old therapy? Like, do you do?
Usually I would do the L-therapy first, and then I would do the injectables immediately following the L-therapy. So that's the,
Immediately following?
yes. Because then you really look like you had a real facelift. Yes.
Okay, good. So are the results of that immediate?
There is like some immediate result, but that also works over time. It's a collagen stimulator. It works on the deeper layer of tissue, which is called a SMAS, which is a layer that you lift when you're doing a facelift. So there, we're not only treating the volume loss, the fine lines and wrinkles, but we're also affecting the deeper structures of the skin, and we're also giving the skin a way to produce more collagen, so the skin itself becomes more radiant and smooth. So it's a
So
real.
would you suggest that someone do them both together, if, or
I
if you had
usually
to
do.
one,
I
which
usually
would you
do all 3 together:
What's the difference?
the Ulthera,
Yeah.
the filler, and
Oh,
the Botox.
So the liquid lift consists of all the different things that you put in,
Yes,
depending on what you need.
yes.
Yeah, the true liquid lift is all the injectables.
There's all the injectables.
Then there's the true
True
transformation,
Which is,
which is the Ulthera
Ulthera,
plus the
plus the
injectables
injectables,
plus the
plus the neurotoxins.
yes, correct.
And the Ulthera, is that your whole face?
Yes, I usually recommend that people do their entire face because there's no place that you really wouldn't want to get the collagen, and the Ulthera, because it's also doing lifting, helps also with the brow position, helps around the eye, helps under the eye, and in any patient that I've done like the lower half of the face, I've always had to do whichever part I didn't do, so I just try to just do it all on the same day, because otherwise,
That Ulthera, how
the
long does it?
Ulthera takes about an hour to do.
is it one time?
Yes.
And how long does it last?
It's not that it doesn't last, it's that you continue to age. So
No, how long does the Ulthera, the effects of it?
it's the results are lasting, it's that your body then continues to age. So in a few years when you're a little bit older, you might have some more changes related to your aging changes, but it's not like the Ulthera goes away.
What if you're too chicken to do all 3 at one time, or it just seems like a lot? Could you do the
You can
Ulthera later on, or?
Sure, you can split them up, but sometimes it depends on the person. Like I would need to understand what was causing the fear, because sometimes once you explain what the reasons are or why you do it, sometimes people don't even know what they're afraid of. It just seems like a lot, but there is a synergistic effect when they're all going on together. So I can't discount that. Like there is a real wow factor when you do all 3 together. I mean, people are usually like crying, like tears of happiness, because they're like, oh my God, it's my face. So it's a pretty exciting treatment. So I think like education of the person is important. Like saying I'm afraid is not enough. I want to know why.
To add to that also, Dr. Levine is one of the only doctors that is able to numb your entire face with lidocaine before you
Right.
get the L therapy. And so even what I just had with the numbing cream, the very superficial numbing cream, takes the edge off. And you see, I wasn't really even flinching because of her technique. But the lighter came, and she can also medicate you. You can take a Valium.
Yeah.
You're literally falling asleep because
Now,
I've
had
done it.
people fall asleep.
So then to do all three is really.
I did it too, I thought it was.
Some people though are very upset with it.
And you loved it.
Yeah, I did
I
my
know
best.
after during all there.
Yes.
I thought it was nothing. I would guess, I thought it was.
I said,
it's
I mean, nothing in terms of pain.
No.
Yeah.
I mean, it's not.
It's not pain, it's pressure, I can't. It's
It's
Yeah, but tomorrow you can go out, you don't have.
You don't get
You're not red?
It's like it
It's
goes
like, it'll go down. I'll be ready for my event.
You'll be ready for your close-up this evening.
Well, that.
Yeah, you'll, in not, if you come back in like 2 weeks, yeah, you'll say,
like a muscle.
you'll notice what you're saying.
I know it's supposed to be thank you for joining us.
You didn't have like a break?
Thank you for joining us at TrueBeauty.com. I hope you've enjoyed watching the True Liquid Lift. And we look forward to seeing you again. Thank you so much. Bye-bye.